Thank you very much for having me. So I've been involved with Planet Youth Lanark County for about a year now, and my role has been to support the research and evaluation activities. My background is generally in evaluation research within community settings, mainly looking at youth-focused programs and positive youth development and mental health promotion. I'm also interested in evaluation with complex system interventions and using ecological approaches. So when I found out that the Icelandic model was being implemented in Lanark County, I was very excited to become involved. So the first project that I was involved with is an evaluation framework that was funded by the Public Health Agency of Canada. So the original intentions for the framework were to support scaling across the country, as well as to create a foundation for the evaluation research in Lanark County. The project evolved a fair amount, and it's landed as being generally an evaluation guide. So there's sort of an evaluation capacity building section, reviewing the basics of evaluation like logic models and indicators and how to use them and how to apply them in complex interventions. And it's mainly focused on implementation kinds of issues. So looking at what adaptations have been made and how the model's been implemented and how it compares with, the 5 guiding principles and the 10 core steps. The Public Health Agency of Canada was also quite interested in looking at positive mental health and whether the model is influential on youth well-being and general mental health. And it's somewhat intuitive to assume that the risk and protective factors that influence substance use are also associated to positive youth development and good functioning as individuals. So the guide is just about finished at this point, and essentially it should be useful, hopefully will be useful, to raise awareness about the model, as well as to be something that folks who are partnering with the Icelandic Center for Social Research and Analysis can use in implementing the Icelandic model, as well as for communities that may not have the opportunity to partner but would like to implement an initiative that's somewhat similar and utilizes some of the same principles. So we've recently also been awarded some federal funding to actually implement this evaluation framework in Lanark County. And this funding opportunity is a patient-oriented research funding that essentially is designed to help researchers collaborate with service consumers, so patients, or in our case, because it's a public health kind of initiative, it's the general youth population. And so the research and evaluation activities will largely focus on how Lanark County is able to engage youth. And that's actually a unique aspect of Planet Youth Lanark County, in that youth are becoming a key stakeholder in the process and will help to inform decision making around what strategies are selected and how it's implemented. So a lot of the research will look at how is that done, what processes are put in place, what lessons learned are achieved, and essentially it will also look at what are youth impressions about these sorts of things. So how do they perceive substance use issues in the community, and what kind of reasoning do they have behind that, and how are they able to explain why it's happening, as well as when the strategy is implemented, how is it influencing them, and what is their experience of that. In addition, they will will engage them in the research as a participatory component, so the youth will be able to select questions of interest and be able to investigate those issues. The evaluation research will also look at whether the Icelandic model does have an influence on mental health, as well as look quite a bit more in depth at implementation. So the research applies a couple of implementation science frameworks, both the National Implementation Research Network. They have some tools and frameworks that are useful, as well as the Quality Implementation Framework. Both of these apply implementation research and have created resources that are useful at looking at implementation within community setting, which is an important adaptation because I find a lot of implementation research is quite linear and assumes a top-down model within organizations. But when you're looking at a collaborative setting, you really have to be using a more participatory approach and following grassroots, because you look at, there'll be power differentials and differences in buy-in and lots of other sort of influences, like for example a pandemic, that needs to be considered. So beyond the general evaluation that's been developed, we're also looking at a new funding opportunity to examine how the community has experienced the pandemic and to adapt the strategy to be able to respond to it. So we're hoping to implement the survey when students go back in the fall, if they go back in the fall. And so it'll be a really good opportunity to look at, what's been going on in the community, how are folks transitioning back to a more regular daily life, and hopefully also serves as an opportunity to identify what needs exist in the community and how we can respond to them. Certainly, a lot of this will come out in the evaluation, regardless of whether we're successful in identifying new funds or accessing new funds, just because this has already been a huge influence in our project. And similar to Ireland, having physical distancing and pandemic related influences impact their intervention and sort of acting as a confounding variable for us, it will influence our baseline measurements. So I'm curious to see what we'll find when we do get started. Just yesterday there was a new study, an article. So the study hasn't been published yet, but there was an article in Toronto Star on a study that's been conducted with the Centre for Addiction and Mental Health in Toronto, and they looked at how COVID-19 has influenced youth mental health and substance use. And they have actually quite interesting findings. So, they saw an increase in things like depression and anxiety and suicidal thoughts, sort of a range of different mental health issues. But they also found that there were some positive impacts. So there was a reduction in substance use behaviors in youth, likely because they're at home with their family and they don't have the opportunities to, go to a pub or go to, a school dance or wherever they are using substances. And there were also some benefits that were identified. So, the youth were able to step out of the rat race and experience some stress relief because they aren't dealing with school and work pressures, and they're spending more time with their family and are also have more free time to sort of engage in like hobbies and relaxation activities. So I'm anticipating that for Planet Youth Lanark County, we'll also see some mixed influences, and looking forward to seeing what we find. So thank you very much for having me, and apologize that I wasn't able to provide live presentation.